Here's a patient who is receiving a scrotal ultrasound, and we can see within the left testicle there's multiple echogenic lesions within the left testicle. And then if we get to the end of the snake clip, we can see a portion of the right testicle, and this also has multiple echogenic lesions as well. Now, the echogenic lesions do not shadow. One could think about, oh, could these represent calcifications? But you would think that something this large, these echogenic lesions, would have some posterior acoustic shadowing if they were calcified. The other thing one can think about is testicular microlithiasis. However, these are too large for testicular microlithiasis. So this is a patient who actually has testicular lipomatosis, which represents collections of intratesticular fat. They are larger than one would expect for testicular microlithiasis. They can be scattered or clustered throughout the testicles. They are commonly bilateral, which is the case in this case. And they should prompt one to think about PTEN hamartoma tumor syndrome, or Cowden syndrome, which is a syndrome in which patients develop multiple hamartomas. And so it's important to raise that as a possibility, since these patients can have hamartomas elsewhere. For example, in the colon, GI hamartomas. They can also be associated with potential thyroid abnormalities. So it's worth perhaps raising the possibility of Cowden syndrome and perhaps do a genetic correlation within this clinical context.